Testing 1 2, testing 1 2 3, testing 1 2, testing 1 2 3, testing 1 2, testing 1 2, testing 1 2 3, testing 1 2.
Welcome everyone to Ted Watkins Memorial Park, where we are finally in possession of the new updated COVID-19 vaccine at this site. So we'll be open tonight until 6 p.m. And from 11 to 6 p.m. every Wednesday through Sunday, throughout the entire fall and winter. We do want to invite people to come into this park. You can walk in at this site. We have people who will answer your questions. And if you want to get the new COVID vaccine and or your new annual flu vaccine, this is the place to come. Again, we have both vaccines here, and we're anxious to go ahead and be able to finally vaccinate folks who have been coming in for the last few days asking about this. Joining me today is Dr. Morales Meyer, who will deliver remarks in Spanish, and then she and I will be available to answer questions. As many of you know, Dr. Davis and I, Dr. Muntu Davis, our health officer, will be here shortly as well. He and I will be going ahead and getting our vaccines today. We know, like everyone else, we are a bit weary of taking safety measures to reduce our risks associated with COVID-19, but we are grateful that we can be here today to take advantage of the protections that are going to be offered by the new updated vaccine. We feel confident that this updated COVID-19 vaccine, designed to target the COVID-19 strains that are currently circulating and recommended for people 6 months and older, will give us an important and much-needed boost as we head into the fall respiratory season. The FDA and the CDC scientists who recommended this updated vaccine have looked at data from the past 2.5 years and at the recent clinical trial results to make the determination that the updated vaccines are safe and provide us with additional protection against severe illness associated with this mutated virus. Although our hospitalization and death rates are low, they are not insignificant. Our own LA data for the past 90 days shows that people who are not vaccinated against COVID-19 were 3 times more likely to be hospitalized and 4 times more likely to die from COVID-19 than people who were vaccinated. This new vaccine is estimated to prevent about 400,000 hospitalizations and 40,000 deaths over the next 2 years. In LA County, we've also seen that certain groups of people are more vulnerable for severe illness from COVID-19, and this continues to be true, especially for older persons and people who are Black and brown. For the 90-day period that ended September 4th, the hospitalization rate amongst Black residents was 2 times higher than the rate among white residents and 3 times higher than the rate among Asian residents. The COVID hospitalization rate amongst people 65 and older was 10 times higher than the hospitalization rate among people younger than 65. Within the 65 plus age group, residents 80 and older are at particularly high risk, with a hospitalization rate that was more than double the rate for those 65 to 79. And over the same recent time period, the COVID death rate amongst people 65 and older was 30 times higher than the death rate among people younger than 65. Again, with residents 80 and older at highest risk. And while the number of people dying is thankfully much lower than at most other points during the pandemic, I do know that there are many families across LA that are grieving the loss of someone they cared about. And I want to extend my heartfelt condolences and prayers to everyone who's lost a loved one during this pandemic. It is especially important for people in the groups experiencing more illness severity to take advantage of this easy access to the updated COVID vaccines. Vaccine supply does, however, as many of you have reported, remain limited across the country. But each day, more and more sites around LA County are receiving the updated COVID-19 vaccine. And we do expect that we'll have more than 1,000 vaccination sites across the county over the next few weeks. Because availability is less than we expected at this point, we do want to emphasize that people in those higher risk groups should make their appointment or visit a site to get vaccinated earlier rather than later to make sure they have increased protection if transmission goes up. Of the sites with or expecting vaccines soon, over 400 sites are going to offer free vaccines to people who are uninsured or underinsured through the CDC, a federal bridge access program. And that includes, we're able to administer those doses here at Ted Watkins Park and at our Obregon Park site. We also have free vaccines on our mobile teams. There are also 337 vaccines for children's sites that offer the COVID-19 vaccine for children, as well as other childhood vaccines free of charge. For people with insurance plans, there should be no out-of-pocket costs. Although I do want to note some residents may need to get vaccinated at a network provider site to avoid those costs. So you'll need to check with your health plan and/or your provider. To find sites that are currently offering vaccine, including those that are offering the Bridge Access Program for people who are uninsured, the Vaccine for Children's program, our public health clinics, our mobile sites, you can go to ph.lacounty.gov/vaccines, scroll down to the Get Vaccinated section, and there's a real-time vaccine finder tool there. So you should be able to easily look in the neighborhood where you live or you work and find a place where you're able to go ahead and either walk in, like at one of our sites, or make an appointment. If you have any questions about the vaccine, you need assistance, you can't find a site, or you're homebound and you need to get vaccinated at your house, please call our public health call center. We're available 7 days a week, 8 a.m. in the morning to 8 p.m. at night. That number is 1-833-540-0473. Given how much sadness and grief so many families already experience, I hope that everyone joins me in recognizing that these vaccines remain a very powerful tool that can help reduce the risks associated with COVID-19, especially as we enter into the fall-winter respiratory season. Now I'm going to bring up Dr. Morales-Myers, who will give brief remarks in Spanish. Then we'll answer your questions, and then Dr. Davis and I will go ahead and get vaccinated.
Muchas gracias, doctora Ferrer. Hola y buenos días. Gracias por venir. Cada día más y más sitios alrededor del condado de Los Ángeles reciben la nueva vacuna de COVID-19. Y ahora esperamos que van a haber más de 1,000 sitios de vacunación en el condado de Los Ángeles que tienen o tendrán la nueva vacuna durante las próximas semanas, incluyendo aquí en este parque Ted Watkins y también en el parque Obregon, que está en el este de Los Ángeles. ¿Quieren que empiece otra vez? ¿Sí? Un poquito más. A ver. ¿Mejor? Ok. Cada día más y más sitios alrededor del condado de Los Ángeles reciben la nueva vacuna COVID-19 y ahora esperamos que hay más de 1,000 sitios de vacunación en el condado de Los Ángeles que tienen o tendrán la nueva vacuna durante las próximas semanas, incluyendo aquí en Ted Watkins Park y también en el Parque Obregon en el este de Los Ángeles. En más de 400 sitios en el condado de Los Ángeles, incluyendo todos los sitios de salud pública, la vacuna será gratis para las personas que no tienen seguro o tienen un seguro insuficiente. Esto es a través del programa Bridge Access del CDC y no debería de haber costo al bolsillo para las personas con Medical y la mayoría de las personas con seguro médico. A pesar de que el riesgo de enfermarse gravemente o morir a causa de COVID-19 es menor ahora que en los últimos años, Los datos locales muestran que durante los últimos 9 días, las personas que no estaban vacunadas contra COVID-19 tienen 3 veces más probabilidades de ser hospitalizados y eran 4 veces más propensos a morir de COVID-19 que las personas vacunadas. Y las personas mayores siguen corriendo un riesgo mucho más mayor. En los últimos 90 días, las personas de 65 años o más fueron hospitalizados 10 veces más que personas menores de 65 años. Y la mortalidad es 30 veces más mayor que las personas menores de esa edad. Se ha demostrado que la nueva vacuna es segura y eficaz. Se prevé que esta nueva vacuna contra COVID está diseñada para atacar los variantes de COVID-19 que circulan actualmente. Esta vacuna está proyectada de evitar alrededor de 400,000 hospitalizaciones y 40,000 muertes en los próximos 2 años. La nueva vacuna de COVID-19 se recomienda para todas las personas empezando de 6 meses en adelante y esperamos que todos aprovechen de esta nueva protección y recomendamos que las personas que se encuentran en grupos de mayor riesgo hagan una cita lo antes posible. Para encontrar más información sobre la nueva vacuna, incluyendo los sitios donde pueden vacunarse, visite ph.lacounty.gov/vaccines. Los enlaces y recursos están disponibles en español. Para aquellos que tienen preguntas adicionales, necesitan ayuda o estén confinados en casa y necesitan vacunarse en su hogar, el Centro de Llamadas de Salud Pública está disponible los 7 días de la semana, de las 8 de la mañana a las 8 de la noche. El número es 833-540-0473. Muchas gracias y ahora la doctora Ferrer para tomar preguntas.
Okay, thank you. You know, we're happy to take questions, and we'll try to answer as many as we can.
You know, I have one.
It's nice to see you again.
Please do. A lot of people, we've been hearing it, we've been story within our community, as they're going out to get the new vaccine, and they're getting slapped with $100, $200 a bill. And so I think a lot of people are kind of hesitant, even me, to go make an appointment.
Yeah.
Could they go to one of these sites and get it and not get that bill?
Yeah. So it's a really great question. Unfortunately, there is some confusion, and it is a different system of distribution than what we enjoyed in the past. In the past, the vaccine was given free to everybody who was vaccinating. Now we're all purchasing commercially the vaccine, which means we're going to look for reimbursement from the health plans and from the insurers. But that makes for a more complicated system for individual people. Now, nobody who's insured should be paying any out-of-pocket costs, but they may, as I noted, need to go to a network site to get vaccinated. So let's use Kaiser as an example because they're a large provider here in LA County and they're a health plan. If you're in Kaiser, you need to check with Kaiser about which sites you can go to get vaccinated because you need to stay in network. And there are other providers that are doing the same, asking people to stay within their network to get vaccinated. At all public health sites, there is no charge for anyone, for uninsured people, underinsured people, or insured people. At all sites, if you're insured, you will be asked to provide your information so that obviously we can bill those insurance companies and get reimbursed for the cost of the vaccine. But there will be no out-of-pocket costs at any of the public health sites. So I urge people who are experiencing that to find a public health site where you can go ahead and get vaccinated or wait until your network sites are opened so that you don't incur those out-of-pocket costs.
So you're in network for everyone?
We're a network for everyone. We're the public health department. So we're a network for everyone and we bill all insurers.
Do you have any insight onto the supply and demand? Because there are several people who told me they've gone to CVS, they didn't have the supply, but they thought they did. So, any insight?
Yeah, I mean, I can't comment with certainty on what's happening with all of the manufacturing and distributing that's going on around the country. But I can say that, yes, things are slower than we expected. We had anticipated by now, for us at the Public Health Department, we would have received our commercially ordered vaccine. We have not. We are borrowing from others. I want to thank Mercy Pharmacy, who's here today with us, supplying vaccine to us so that we can vaccinate people who are insured. And even we haven't gotten our second allotment of our bridge access vaccines either, which we had anticipated getting by now. So I do understand the frustration. Please check ahead of time before you go to a site to make sure that they have vaccine. And I know the pharmacies have been really ramping up very quickly, but some pharmacies are saying that they're running out and they're now scheduling much further out. I do think some other pharmacies are just coming online because they've just received their doses, so it's worth checking around. We try to be as accurate as possible on our website, but we do urge people, since there is some limited supply at the moment, particularly for some sites, to make sure before you go that you know that they have vaccine.
Doctor, which manufacturer are you distributing through?
Well, we have both Pfizer and Moderna.
Okay. Second question, when will the briefings be returned back to downtown?
Well, we're in a place where we're only doing briefings when there's something really important for us to communicate. So with our numbers staying relatively stable, we've really not scheduled regular briefings. I think if that situation changed, we would, of course, bring people back together and explain what kinds of strategies we can all be using to enhance our safety. We're doing briefings now really just to make sure people have good information about how to get vaccinated.
I just have another question. Are we in the new normal now where it is just, we're going to have a different, like the flu, except
Yeah.
of course, it's different from the flu. But is this how we're going to be from now on? A new vaccine every year, it's COVID season, can get your vaccine?
That's our sense. CDC hasn't said that officially, but everyone is really working under an impression that an annual COVID vaccine will provide us with the needed protection for COVID, at least for the majority of people. I do want to note that everyone who has serious underlying health conditions should be checking with their provider about the best scheduling for their doses. Because as you know, we all need one dose, but some people might need more than one dose, including some younger children.
And my next question is, if you can explain to the public the difference, because I was speaking with someone, I think I've had 3 or 4 shots, and I'm like, well,
Yes.
this one's really different. So can you
Yeah.
explain the difference?
Yeah, it's a really good question. I mean, I feel the same way. I've had so many shots. Do I really need another one? I think that's the question. I've had so many shots. A lot of people, we got vaccinated. Maybe we got infected as well. We know we get some protection from being infected. The issue in front of us is that with both the vaccines and with a previous infection, there's what we call waning protection. So your immune system is ramped up, it's ready to go, but over time, that diminishes. And that's why we talk about getting an annual flu shot or an annual COVID vaccine. The second reason is these viruses mutate, and we try to, in the updated vaccines that we get, that for flu we've experienced as annual, we try to match what the vaccine is formulated to give us the most protection against with what we anticipate will be circulating. So we all know that the original vaccine was for the ancestral strain. Then we had a bivalent that was the ancestral strain plus Omicron. And now we have a vaccine that's really targeted to XBB, the strain of Omicron that's circulating. It's a monovalent. It's just really targeted for that strain, but that's what's circulating. So that's really good news for us. But that's the second reason why you want to get your updated protection.
Dr. Ferrer, we have several questions sent in from Christy Hutchings at LA Daily News. Does the county have any inkling of how interested the general public will be in receiving an updated COVID vaccine? Is there a sense that the public may not think they need a shot? What is DPH's advice in that regard?
Yeah, I appreciate that question. I mean, one thing we know is there's a lot of demand right now, and I think we've seen that every time there's been a new product, a new vaccine. We've had a lot of initial demand. The people who, many of the people who are most at risk, lots of people have been waiting almost a year now for this, and they want the additional protection. But there are 10 million people in LA County, most of whom are going to be eligible for this vaccine. So we have a lot of work to do to make sure that they're getting good information. Our community health workers and promotoras are out knocking on doors again. They're out at events. We're doing more telebriefings to bring in different sector partners. We're offering, again, the ability and making it clear that we can go to people's homes. We contact everybody who's homebound and received a vaccine from us to let them know that it's time for them to get a new vaccine. And, you know, so the outreach work at our schools, at our community sites, with our labor partners, that all is happening. I think it's a great question. How do people know and sort through what's right for them? And as I noted, you know, we have a call center open 7 days a week where we can answer people's questions. We think there are a lot of questions. We're happy to answer them. We encourage people to also go to their providers to get answers, because it is important that people understand these new vaccines provide us with a boost in our immune system. That additional protection will be helpful, particularly as we go into the fall and winter, when we have more circulation of viruses, we're indoors more, and we do a lot of travel and gathering around the holidays.
From Jackie Fortier at LAist, will all the pediatric doses be available at the pods? Just to be clear, some people seem to be having trouble getting their young children vaccinated.
I'm going to ask Dr. Morales Myers who's in charge of our pods.
So our pods will have vaccine available for pediatrics. Right now, we haven't received our doses, and we're expecting to get them this week. So please make sure to check. Our pod sites are listed on My Turn, so you can check there for our appointments, and it will list the vaccines that are available. You can also check our website as well. We have walk-ups, we can make appointments, yes. And this is one pod site here at Ted Watkins, but we also have Obregon Park in East LA, so those two sites.
And we have our mobile.
And we have our mobile clinics as well, yes.
One more question from Marla Tellez from Fox 11. What is the root cause of the delay? I've also spoken to several doctors at major hospitals, UCLA and St. John's Medical Center. They say they have no vaccine supply. What should they tell their inquiring patients?
Yeah, it's a great question, and I spoke about, you know, both the manufacturers and the distributors are having delays. We've been assured it's not a supply issue, it's a distribution issue, getting it out to the many sites. Remember, we're switching to an entirely new system where people had to actually order directly from the manufacturer. So one thing is, some people just put their orders in, and the manufacturers are now trying to get orders out as quickly as they can through a distribution network. I do think the message is be patient. It is important to get vaccinated. Check around. We already know there are many sites that are offering vaccines. So if you have patients who urgently need to get vaccinated, they're older, they're at risk, they're traveling and they want to make sure they get their vaccines before they travel, please urge them to go to our website to find which sites are in fact able to already offer vaccines. Many of the pharmacy chains put in their orders early and receive vaccine doses already. So one good place to check is your neighborhood pharmacy, particularly Walgreens, Rite Aid, CVS. I think Vons is opening today in their pharmacies. So we urge people to check and not get discouraged. Other people may in fact be willing to wait a little bit longer to get your vaccination, and that also makes sense for some folks. But we anticipate in the next 2 or 3 weeks there should be no problem with supply availability in LA County.
Any
We
final
hope.
questions from the room?
Long COVID was the big headline yesterday.
Yes.
Releasing information about 18 million Americans who have suffered from it. And the message before has been, if you get
Yes, I mean, all of the strains we've seen to date have caused some people to experience long COVID, having prolonged symptoms associated with their infection that last typically 3 months or longer. So yes, we are seeing that with all of the different strains, and we have heard that in clinical studies, this vaccine, again, like our earlier vaccines, is offering protection against long COVID. I don't think it's been quantified how much protection, but again, the vaccines are highly effective at reducing the burden of severe illness, and severe illness for many people has been associated also with long COVID. So yes, we encourage people, sorry, to pay attention to the fact that, there's a couple of risks here that we don't talk as often about as we might, which is your risk of long COVID and your risk of having repeated infections that also create higher risk later on. Sorry. So again, we think both of those are good considerations.
No final questions?
Okay,
Let's get vaccinated.
we'll get vaccinated. Dr. Davis. For those of you who haven't met Dr. Davis, our health officer, so he and I are both getting vaccinated. Where do you want us? And we still do a 15-minute observation here, so that's where I'm headed.